this one. So this is a simulated patient task assessing communication with patients, applied clinical knowledge, and communication with colleagues. You're the ST5 in the antenatal clinic. Midwife tells you that your next patient is Rebecca Mark. Well, we've been using Rebecca a lot today. 35 years old, primip, who was low risk. Okay, so it's low risk pregnancy. So low risk pregnancy means that she's following up with the midwife. She doesn't come into clinic for actual follow-up or booking the pregnancy. She booked her pregnancy just with the midwife. No medical problems, no relevant family history. So you have some of history here. She came in to discuss her Down syndrome screening results. She's expecting to see the consultant, but he has been called away. So she's expecting to see the consultant. You need to cover that part. Introduce yourself and just apologize that the consultant is not available and if it's okay to proceed with the scenario. You can find this tucked in a random case scenario. Now, ideally, since she has her Down syndrome screening test, I should have put her gestational age, but let's say gestational age is around 14 weeks. She's 14 weeks now. In clinic, you would have access to her booking scan, booking bloods, and each and every scan that was done until now. So her booking BMI is 23.5, blood group A negative, Hep B HIV negative, hemoglobinopathy is negative. So her booking bloods are okay. You have her scan, dating scan with her name, was done at 12 weeks, everything's fine. Knuckle translucency 4 millimeter. You have her screening test. Usually, just not to waste time, look at the interpretation. Is it increased risk or not? That's all what you need to know. Okay, so here I would look at increased risk and look at the number because I would explain that to the patient. Now, before we go ahead, you need to bear in mind that each and every patient is counseled before any scan, any test, and their consent is taken. So midwives usually explain to the patient the Down syndrome screening test, what it entitles, how it's done, and what's the aim of doing that result. Oh, sorry, that test. Patients already know. So here, Rebecca is coming after the screening test. If the screening test result was normal, she wouldn't be coming to see you. She will just continue with her community midwife. But community midwife referred her because the result is abnormal. There's some midwives who are called screening midwives. They usually discuss that with patients. Usually you don't do that in clinic, but in the exam, just to test your knowledge. And if you know how to discuss these things, they will bring it. Okay. Now, till now, we know that Rebecca has been counseled by her midwife before having the test. She agreed. Now, when I start off, before explaining the results, I want to know what she knows about the test. Does she know about the result? If so, no. And does she know what the test was done for? Just to have that basic understanding and both of us be on the same page before I explain the results. Okay, and then I go and explain the results, make it clear that it just shows an increased risk, and I mention it in numbers and find a clear, very simple way of explaining it. You're not required to take any history here because it's not relevant and I'm not asking for it. Some people, despite knowing that under the domains there's no information gathering, they go and take history. It would just be a complete waste of time. And even at the bottom, you have 10 minutes to explain the results of the screening, discuss further management of this pregnancy, answer and address health concerns. Now, in terms of your management plan, you know it's an increased risk for Down syndrome. Next step would be options. She has options 1, 2, and 3. Okay, and remember, it's not a must to have further tests done, either further screening or confirmatory tests. The patient has the right to know that she can do nothing about it and not do any further testing. In that case, she wouldn't know if her baby has Down syndrome or not. She will only be able to know after delivery. Sometimes during antenatal scanning, some abnormalities can be picked up, but it's not always the case. Okay, so give options in a clear nice way with a full explanation of each option, inviting questions between each option, and at the end, asking her what she would like to do. If she's decided, then that's fine and well. If not, then give her time to think. Okay? Who wants to do this case scenario? Okay, I think I'll help a bit in terms of option. Just type down headings. Okay, I'm putting it down here. So her options would be to choose to do nothing at all. In that case, like I said, shouldn't know if baby has Down syndrome or not. You can go with another screening test, which is NIPT, and you explain that to her. Explain clearly it's a screening test, but it's more accurate. The result, if comes low risk, then no further action needs to be taken. Pregnancy would be treated as managed and followed up as normal. And if it comes at a high risk, we still need to confirm it. Okay. The third option is going ahead right away with diagnostic tests, CVS, and amniocentesis, depending on the gestational age, and explain how it's done, who's going to do it, what are the risks, especially the most important risk of a miscarriage, risk of infection sometimes, how long will the results take, and what the results would be. It can either be inconclusive, meaning we don't know, or we don't have a result. It can be negative, meaning baby doesn't have Down syndrome, or it can be positive, meaning baby has Down syndrome. That's all what you need to explain. Okay, so I think I've made your life easy. Who wants to give it a try? You don't need to take history. Proper introduction, elicit from me what I know so far, explain the results of increased risk, what it means, break it down in numbers, 1 in 151, see if I understand, have any questions, then take me through the options 1, 2, and 3. Okay, Anjuman, thank you. So you want to go ahead? I can be your patient. Yep, can you unmute your mic?
Okay. Okay, ma'am.
Yep, all right. So I'll give you your 2 minutes to read. You can start reading now.
Okay.
You can start, Anju.
Okay. Hello, I am Anjuman, one of the doctors in the international clinic today. May I know your name and age, please?
Hi, I'm Rebecca Mark. I'm 35 years old.
How may I address you?
Rebecca would be fine.
Okay. Rebecca, thank you. I have gone through your notes and it says that it is your first pregnancy and you are here to discuss about the report. Am I right?
Yes, that's right.
Okay, can I ask you a few more questions and later on examine you, and after that can we discuss the report? It will help our discussion. Is it
Okay.
okay for you?
Yeah, Anju, I'm going to pause. So I'm just stop you here. You said you're going to asked me a few questions, so I'll skip that bit. Maybe you want there's no just bear in mind there's no history taking. Maybe you want to ask me about what I know so far, but then you're not going to examine me. I'm 14 weeks. I don't have any problems. Early pregnancy. If you examine, what are you going to examine for? You're not going to feel a uterus. Everything's fine on my scan. I'm not having any bleeding. Okay, so no need for examination. Okay,
Okay.
all right.
Okay.
Let's start this again. Start from the beginning.
Uh, from the management part or from the history taking part, ma'am?
From the introduction. Start the case from the beginning.
Okay. Hello, I am Anjuman, one of the doctor in the antenatal clinic. May I know your name and age, please?
Hi, I'm Rebecca Mark. I'm 35.
How may I address you?
Rebecca, please.
Okay, Rebecca. Rebecca, I can see that it is your first pregnancy and you are here to discuss a report. Am I right?
Yes.
Okay, can I ask you questions and later on can we discuss about the report?
Yes, that's fine. Okay.
Okay, Rebecca, can you tell me about your pregnancy so far? How is it going?
It's been fine. I'm 14 weeks now. I had a bit of morning sickness at the beginning, but that's gone now. Yeah, I don't have any problems.
Okay, that's easy to plan pregnancy.
Yes, it's a planned one.
Then congratulations. Uh,
Thank you.
but, uh, I, okay, are you taking on in? Are you on any medication right now?
No,
Like, are you taking folic acids?
I took it at the beginning, but then my midwife told me to stop it when I was 12 weeks.
Okay, that's good. Okay, Rebecca, and do you have any? I mean, any bleeding from your down below?
No,
Okay. Do you have any other medical condition, high blood pressure, sugar, or
no,
any surgery in your tummy or down below?
no,
Any familial condition any condition that runs into your family?
not that I'm aware of.
Okay. Uh, uh, can you tell, have you, I mean, have you ever, I mean, is there any condition that are you aware of about your partner's family?
Yes, they're quite fine. They don't have any issues or problems.
Okay. Can I ask about your social habits like smoking, alcohol?
No, I don't do it. I mean, I do drink socially out of pregnancy, but in pregnancy, I don't.
That's very good that you have stopped smoking. And do you have any allergy?
No.
And okay, are you aware about your weight height ratio?
No, I'm not. But they did. The midwife did take it at the beginning of my pregnancy. I don't know if it's there on my notes.
Okay, I want to, okay, in that, can I go through your notes?
Yeah, it's here in front of you. I have all my scans and my tests.
Yeah, I can see. Okay, thank you, Rebecca, for your cooperation. Now I want to, I have matched the name and NHS number of the report and it belongs to you. And there are several reports and one of his, the blood, there are blood reports says there is no hepatitis germs like hepatitis B or hepatitis HIV. That's good. And there is a no disorder, I mean, in blood formation, what we call hemoglobinopathy. Rebecca, are you here alone?
Yes, I came alone. That's fine.
Okay, actually, I have gone through your scan report. Your scan report is not well, but it will be better if I call someone to be with you. How it sounds to you?
No, that's fine. I'm okay.
Okay. Rebecca, your scan reports says that you were 12 weeks pregnant. Babies has good heartbeat, and but one after birth is also in norm okay. But there are some thickness in the fetal neck. The thickness of the fetal neck is increased. That it is called nuchal translucence, nuchal thickness. There are also some concern in the blood, reports, and it says that uh, risk is there is increased risk of Down syndrome. Have you heard of it?
Yes, I mean, my midwife did tell me about that, that the result is to basically, or the test is to see the risk of my baby having Down. So I hope I'm not mistaken.
Yeah, you're right. Do you know about Down syndrome? How much? I mean, have you heard of it?
Yes, I mean, I do have a friend who has a daughter with Down syndrome. I find her quite lovely and beautiful. I mean, she's independent. They do have some learning disabilities, sometimes health issues.
Yeah, you are right. You are absolutely right. Down syndrome is a genetic disease. I mean, where baby have extra chromosomes in where, okay, and it also varies a lot of. It ranges from learning disabilities. Some babies need support throughout their life, and some may have physical defect. Okay, uh, am I clear so far, Rebecca?
Yes.
Okay, among the defects, baby may develop defect in their bowel, defect in their heart, and defect in their sometimes brain. Okay, and though it is not so prominent here, if you am I clear? So, but whenever further scan, it may be visible whether, and some babies may not be compatible with the life. Am I? Yeah, am I clear, Rebecca?
Yes, you are clear. So what's going to happen now?
Okay, but at the result you have are screening test. Screening test means it is the primary test. Okay, so but Dara, at this point we need to. I would like to refer you with our. I would like to connect you with our consultative care as well as fetal medicine. Okay, and also a specialist nurse will be there to help you to take the decisions. As the screening test means these are the primary tests, and at this point we need to confirm whether baby has Down syndrome or not. There are several options, like as in case of high risk mother. In case of mother who have high risk of having babies for Downs, there are options of needle test to to be sure whether baby has this syndrome or not. The needle test means we will take some tissues from afterbirth or the fluid afterbirth or the fluid around the baby or with when the timing matches. I mean, afterbirth, if taking tissue from the afterbirth, we called it CBS. We take it from 10 weeks and afterwards. But if we and in case of fluid, we also examine fluid around the baby, take some fluid around the baby, but we do it after 15 weeks. And am I clear so far?
Yes.
Both has 99.9% accuracy, but there is also little chance of abortion of the baby. It is 0.5% to vary to 0.5 to 0.5 to 1%. Okay, yeah. What do you say, Rebecca?
So I mean, is there any other test that I can do apart from that needle test? I'm just scared from that risk of miscarriage. I know it's small, but it's just quite scary.
Yeah, but there is other test that we will take some blood from you, the what we call non-invasive prenatal test, okay? But it is also a screening test, though it is 99% have confirmatory result. But it is it is not so. I mean, we don't consider it confirmatory. We also consider it as screening. Am I clear, Rebecca?
Yes.
Okay, and some point some women may want to continue the pregnancy after that, or some women may want to does not. Yeah, well, do you have any specific? I mean, what you say at this
I
point?
mean, to be honest, I would like to discuss this with my partner, but initially for me, I don't really mind having a baby with Down syndrome. I mean, that wouldn't make me, if for God forbid my baby turns out to have Down syndrome, it's not gonna make me decide on ending the pregnancy. I would still like to have the baby.
Okay. whatever your decision will be we will be with you. If you want to continue the pregnancy, we will be put on under consultant-led care. Okay, and then our consultant, also there will be a specialized nurse with you. We will do a scan to check the baby's at 20 weeks, a special scan, what we call anomaly scan. Okay, and whenever at and at third 9 month we will discuss you about the delivery options as well. Am I clear, Rebecca?
Yes, you are.
Okay, and but now as there is a lot of information, I am giving you also patient information leaflet and introduce you support groups like there are support groups also like SANS and right back and give you give you patient information leaflet and okay, and if and book an appointment with fetal maternal medicine. Is it okay for you?
Yes, that's okay. And I just have a question. Um, if I choose not to have any testing done, or let's say I choose to have the test done and my baby turns out to have Down syndrome, would I be able to know how badly my baby is affected during the pregnancy?
Yeah. Actually, we will do a special scan to see how to see the defect in the baby, for if there is any birth defect of the baby, as Down has several implications on baby, several implications of birth defect at 20 weeks. But at this point, we can only detect the physical disabilities. Okay, regarding the mental condition, we will have and after regarding the mental assessment of the baby, we can't decide it at the before after I mean before birth.
Okay.
Okay,
Yeah.
is there anything else you want to ask?
No, there's no question at the moment. No.
Okay, thank you, Rebecca.
Thank you. How did it go, Andrew?
Ma'am, I'm not, I'm it is not up to the mark, and the Down syndrome I just missed here at the management part.
All right. Okay. I'll just mute you for now. Thank you so much for doing the case. Okay. Just let me put your mark here. Okay, so Andrew, at the beginning, I gave you a passing communication with the patient, but just for you to be, you did some mistakes here and there. So I'm quite tough in marking, just so that you would, sometimes you can do mistakes, but despite those mistakes, you will still pass that domain. But then again, if those mistakes, you add to them other mistakes as well, you can be down marked to either borderline or fail. That's why whenever I pick up small mistakes as well, that are really important for you to keep an eye on and be aware of them, I usually down mark just for learning purposes. Okay, so here I realize there's a lot difference from the when you did the first case and now in terms of your communication. You're more confident now, you're coherent, and you have a good flow and you're inviting questions at appropriate intervals. Okay, well done here. I gave you a borderline because, first of all, you didn't inquire at the beginning what I know about the test. Okay, that could be a good way to create a report at the beginning. You did take history, despite me saying no information gathering. You can see that I'm only marking you on 3 domains here. There's no information gathering. Okay, and I did mark you to until towards the end of the time, but you did run out of time. I had some questions that I wanted to ask as well, and in the exam, any question asked by the role player, they're actors, they're given instructions. They don't ask questions out of their minds, out of their heads. Okay, they have a list of questions, and each question there's a mark for answering it. Okay, so when you don't have information gathering, try to resist that feeling of wanting to take history. They're not marking you. I'm not marking you on that in this case. And that can come in any case scenario in the exam. Yes, in practice, in clinic, you would ask some questions in this case, but in the exam, they're focusing, they want to assess you in other domains, not information gathering. Plus here, all the questions you asked me, they have no relevance at all with regards to what you're going to do next. Now, I just made a mistake that I didn't put patient safety here. I should have put patient safety because she's rhesus negative. And when you talk about chorionic villus sampling or amniocentesis, you have to mention that we will give you an anti-D with those procedures. Okay? If there was patient safety here, it would have been a fail because you didn't recognize that she may require anti-D, and that would be the case if she would do the diagnostic test. Okay? You also took it as breaking bad news, asking if I want someone with me. Now, in the UK, some parents are really, they're okay with baby having Down syndrome. They they don't find it as a problem. Some others would be quite anxious and wouldn't want a baby with Down syndrome. Okay? That's why I said always check what I understand at the beginning before going ahead with explaining the results. Because if you had asked me that question, I would have been, yeah, okay, I'm fine. I know it's a screening test plus. You've asked me what I understand about babies with Down syndrome. You asked that question at the beginning, not after you explained the results. I would have told you, well, they're lovely children. They're fine. I have a friend with a baby with Down syndrome. So I showed you that I'm okay with the fact of children having Down syndrome. But if I was anxious from the beginning and told you I'm just really anxious and worried about my test results, that means I do have a problem. I'm worried if that my baby will come as increased risk. And then if my baby does have Down syndrome later on when I have the diagnostic tests, okay? In that case, you will offer me someone to be with me, okay? You offered SANS. SANS is for, it's support groups for people who lost their babies. Either it's an IUFD or the baby has a lethal abnormality that's not compatible with life. Okay, it's not relevant here at all. That baby is alive and well at the moment. Okay, so no need at all. Even if babies have complex abnormalities, but they're still compatible with life, that baby is not dead yet. Only offer SANS when there is IUFD or stillbirth. Okay, I just wanted to highlight that point. I really like the fact that you congratulated me for my pregnancy. Well done. Um, your explanation of knuckle translucency was a little bit complex. Just say the thickness on the back of baby's neck. That was what was measured. Okay, that can be your explanation for knuckle translucency. Communication with colleagues. I gave you a pass right away when you involved FMU, especially for the diagnostic tests. And in terms of applied clinical knowledge, you talk about what needs to be done from now on, what my options are. CVS and amniocentesis, you demonstrate your knowledge regarding from what gestational age each would be done. You also covered the risk of 1% miscarriage, most important that patient has to know. I did, and then after that, you asked me, what do you think? You could just ask me, do you have any questions so far? And on your own, go with the other, offer me the NIPT. That's one of the options. Okay, don't offer me NIPT if I decline diagnostic test. I have the right to know that equally I can choose either to go ahead with the diagnostic test right away, or I can choose to do the NIPT, and then depending on the result, if I want, I would go and have a diagnostic test. The last option that you forgot is to do nothing at all. So that's why I prompted you the last question. If I choose not to know if my baby has Down syndrome, would I be able to know if my baby is affected physically? Okay, and you answered that question right. Sometimes in terms of physical problems, they can be picked up with scanning, but some of them may not be picked up. In terms of learning difficulties, it would only be known after baby is born if your baby has Down syndrome, right? Now here, Andrew, again, I just want you to focus on all of you on the beginning. So because when you start, you can see here, this case scenario, the first case scenario, did an endometrial hyperplasia without atypia. The starting point is the most important point for you to know what you're going to mention and how much you're going to mention, or what would be your starting point. Hello, my name is Wafa. I'm one of doctors in clinic today. May I confirm your name and age, please? Rebecca Mark, 35 years old. Is it okay if I call you Rebecca? Yes, please call me Wafa. How are you doing this morning, Rebecca? I'm doing fine, thank you. Okay, that's good. So Rebecca, I understand that you. How many weeks are you in your in pregnancy? 14. Okay, so you're 14 weeks into your first pregnancy. How's everything been going on so far? Everything's okay? Yeah, no problems at all. Um, I understand that you had screening tests for Down syndrome. Am I right? You will say yes. So I do have the results with me today, but before going ahead with discussing them, can you share with me what you understand about that test or this test? Okay, she can. I would just want to make sure that she knows that this is a screening test and she understands. Okay. Then after she tells me, well, my midwife told me it's a test just to see the risk of my baby having Down syndrome, I'll tell her that's absolutely correct. And do you have any information about children with Down syndrome at all? Okay, just these are all screening questions for me to kind of, understand what she understands, for me to know what she understands, what she's thinking about, because it will help me to go on to the next step and also how I'm going to explain the results. I'm going to break it as bad news or explain it normally, but in most of the cases, explain it as normal because it's just, like you said, it's a screening test. It doesn't mean baby has Down syndrome. If this was a diagnostic test, a result of amnio or CVS, then you know that baby 100% has Down syndrome. You take it as baby and breaking bad news. Okay, so after she finishes, I'm taking my time here in eliciting information from her in terms of her understanding about the test and Down syndrome because I know I do not have history taking. Those 3 minutes are not going to be wasted in history taking. I have lots of time to cover things. Okay, and then I tell her, okay, so after confirming that the result belongs to you, I'm not going to go and explain to her her booking bloods. Her booking BMI, blood group, and viral screening and all these tests were done at booking with the midwife. They're there just because you have to know them. The blood group is relevant. Her HIV hepatitis status is relevant in case you're going to go ahead with explaining the diagnostic tests. They're, they're done and dusted at the beginning. What I'm supposed to explain is the result of screening, and it's clearly mentioned here at the bottom. So, Andrew, you don't have to explain everything. Sometimes you can have a patient coming in, she's 32 weeks pregnant, okay, let's say she's a high risk pregnancy for any reason, and they provide you with all her booking bloods, her booking scan, her anomaly scan, if she was on growth scans, all her growth scans will be there. Are you going to explain all of that from the beginning? No. You're just going to say, okay, 32 weeks. From reading the scenario, you would know why she's here and taking things forward from this point. If she had a recent growth scan, then you're going to explain that if it has an impact on your management plan. Okay, so again, repeat, not all the investigation results that's given to you in the exam, and in the exam, they can be more than this. Those have taken the exam before, they know you can have 3-4 pages to go through. Okay, so after I did that initial introduction, I asked the patient about her understanding regarding, does she know why the test result was done, and what does she know about Down syndrome, if she has any information, and then I'll go and explain it to her. So I'll tell her, so Rebecca, after confirming the results belong to you. So basically what was done is that during your dating scan, the thickness on the back of baby's neck was measured and it was combined with the blood test that you had. And we came up with a result in numbers. Okay. Taking your age only, since you're 35, the risk of your baby having Down syndrome is if we take 474 women with your exact same age, only one of them will have a baby with Down syndrome. So that's a more generalized estimation of risk. To personalize it more for you, we did the scan and the blood test. Okay, your result came as increased risk, meaning that if 151 women with the same test result as yours, okay, have a baby, only one of them will have a baby with Down syndrome. Is that clear? Does that make sense to you? Make sure she understands it's a screening test. So tell her from this test, we can't say if baby has Down syndrome or not, but it does enable us to do further testing to know. Okay, I'm going to tell her in terms of your options, you have 3 options. I'm going to take you through them. feel free to stop me at any point if you want to ask any questions. So I'll start out. The first option is to do nothing at all and continue with the usual follow-up of the pregnancy, but then we would be doing a detailed anomaly scan at 20 weeks and then growth scans further on. And sometimes scans may pick up that baby has abnormalities that would indicate Down syndrome, but in other times the scans may be absolutely fine. And the only way to know if your baby has Down syndrome is after you give birth. The second option is going ahead with another screening test. It's called NIPT. We basically take a blood sample from you and test it. It's much more accurate than the test that you've had. If it comes out as low risk, that means there's a very low chance that baby has Down syndrome. You will continue with your usual pregnancy follow-up as if your baby does not have Down syndrome. If it comes as increased risk, that means we would still need to confirm if the baby has Down syndrome or not by doing further detailed testing. Any questions? No. The third option is that you can skip the blood screening test and go ahead right away with the diagnostic test that would confirm whether baby does or does not have Down syndrome, and that is done by our specialist fetal medicine unit, in which you would be referred to them. And basically, there's two types of tests. Since you're 14 weeks now, if you have it done prior to 15 weeks, the test, we can take a sample, a needle through your belly to the afterbirth and take a sample from there that has some of baby's cells. If you go beyond 15 weeks, then the sample will be, again, a needle through your belly, take a sample from the fluid around the baby, and that fluid as well has some of baby's cells. It will be taken to the lab, the sample to be tested and looked under the microscope, and we look at the genetic makeup, and that's how we would know if baby has Down syndrome or not, because there's an extra chromosome or a genetic link at chromosome number 21. I know it's a little bit complicated, but I just want to explain to you how we would diagnose it. With this procedure, the needle test, there's a 1 out of 100 chance that a miscarriage may happen. Also, there's a risk of infection as well. The results usually take around 3 to 4 weeks to come out, and you can expect one out of 3, either inconclusive, meaning that we couldn't obtain enough sample. In that case, you would be offered a repeat testing, or it can come out as negative, meaning baby doesn't have Down syndrome. In that case, you will continue your pregnancy as normal with your midwife, or it can come as positive, meaning baby does for sure have Down syndrome. In that case, we'll discuss with you your options and your pregnancy follow-up on what you would like to do. Since your blood group is A negative, if you opt to go ahead with the needle testing, we would give you an anti-D injection just because of that chance of baby's blood mixing up with yours, and we don't want that to happen. Okay. Any questions so far? So do you have any thoughts about what you would like to opt for or go ahead with? So that's how you're going to end, okay, asking what are her thoughts. She tells you, I want to go ahead with the diagnostic. That's all her, okay. I'll make sure we refer you to our FFA. You're going to hear from them regarding your appointment, and then they explain to you everything in detail and go ahead with the tests. If she tells you I want to go with NIPT, okay, I refer you to the screening department here with the screening midwives. They will arrange that test to be done for you. If it tells you I want to do nothing, that's okay. That's absolutely your choice. So we will be labeling your pregnancy as high risk because we don't know whether your baby has Down syndrome or not. You're going to be having a detailed scan at 20 weeks, and then after that, serial scans to check the growth of your baby. Okay, if it tells you I want to think about stuff, okay, you can take your time, think about it. I'll give you a leaflet. Once you make up your mind, just let your midwife know so she can do the appropriate referral for whichever test you decide to do. Okay, so it's just the patient. You don't need to complicate things. Give her, explain to, so I always imagine that I'm a patient, okay, because once it was the first and only time I went to a doctor. I had some peripheral neuropathy symptoms, so I went, and what I liked about that neurologist is that he After history and examination, he explained to me clearly the neurons and why I'm having those symptoms and everything. Then he explained, and that he drew for me as well. And then he took me through what other tests we would like to do, what those tests will pick up, and so on. So, me as a patient, I felt comfortable. I understood everything. You do the same in the exam. That's all what is required from you. Okay. Angie, do you have any questions? Angie, you can unmute yourself.
Thank you, ma'am. Ma'am, as I want to ask you a question, as you said that if any role player or patient does not want to do the needle test, in that case, should we also should we tell about the entity? I mean, she is not interested, but I mean,
Yeah,
hello.
NIPT. Yeah, you can offer her NIPT. It's one of the options. Diagnostic test is one of the options. NIPT is one of the options. Even if she doesn't say she doesn't want a diagnostic test, she still has the right to know there's an NIPT that can. It's more accurate, and instead of her going with the diagnostic test right away, and she can choose to have the NIPT. If it comes as increased risk, then she may think about doing the diagnostic tests.
Okay, if she has twin pregnancy, does the NIPT works?
With twin pregnancy, I'm not really sure about that, but I do not think so. No, no, I do not think so. But I'll double check that and write it on the group.
Okay, ma'am. There are similar scenario in the exam, but she has twin pregnancy, DD, die. So I
Die,
have
die. I don't think it will work because these are like die. They're not even, the choriodicity is not even the same. It wouldn't pick up which one of the babies has Down syndrome. Yeah.
yeah
So it wouldn't work
yeah.
for die. Yeah.
But in that case, baby has cystic fibrosis. But she wants to know she has want to know what are the chance of the cystic fibrosis of the baby. Uh,
So yeah, in that
so
case, you would offer her diagnostic test because they will be
from
taking the sample from each fetus separately and testing which one has the cystic fibrosis.
okay.
Yeah.
Okay, ma'am. Thank you.
Okay. Does anyone have any question here?